Going into my favorite time of year. All winter.
Well, I did not hear that. You did. I wanted to ask you about
It's gonna
the
overcast.
big
It's a
thing
little too
I'm
much.
talking, about was the camp, the control camp, the north end of it. Because Tony wanted, I'm gonna see the commissioner there.
Oh, sorry. Can we take more than one? I need the box. I'm the only one over here.
Yeah, the news did report. I knew there'd be reason because you
Oh God, I started last
well,
week.
not change.
I was Tuesday night, in the middle of the night, I like crashed and
I go, there's gotta be more.
Oh,
and then
I did not
really
really
called me yesterday and said I'm not coming in. And so I took a sick day yesterday and I got better. I got a lot better. Good, recovering. I was down on the couch yesterday.
You don't have
Versus my whole day, did not, didn't touch
I
it.
know people.
And I like using it, stood up, put it up, and I was laid in bed all day, and I just like, it helped. You know, right? It's hard. It's a hard job.
I like that.
I don't know.
Nobody listened.
I was trying to.
Nobody heard me.
The damn earthquake alarm.
I wanted to hear that.
Well, what do you think?
Like
Do I not
18,000
want to
of
get
them.
something accomplished?
You really.
Welcome. Hey, everybody. Let's see, need to do introductions. Have a couple visitors. Go ahead, Mike.
Captain Michael Schultz, Deschutes County Sheriff's Office. I operate in the jails and
I'm just took a bite of food. Amber Clegg, I'm a clinical program manager here for our behavioral health division and health services.
Linda Nosey, I'm an adult foster home provider for adults of IDD.
Christina Lee, I work for St. Charles and I'm a board member.
Hi, I'm Lindsay Hoffman. I'm a clinical supervisor for Deschutes County Behavioral Health with Intensive Youth Services, and I am covering for Shannon today.
I like your little modifier.
I know, right? I was like,
Smart.
yeah.
Holly Harris, Behavioral Health Director. Good to see all of you.
Hi, Krista Mazzocchi, Program Manager. Ashton Varner, Diversity, Equity, Inclusion Specialist, strategist for Deschutes County Health Services. And I actually work out of our little Wyatt Annex over there in admin.
Hi, I'm Dana Murray. I'm the admin assistant for Deschutes County Behavioral Health.
Jessica Vieira, community member.
Melinda Thomas, I'm an attorney with High Desert ESD and a board member. Julie McFarland, board member and small business owner.
Orla Krasilnik, board member.
Patty Adair, Deschutes County Commissioner, and I just actually want to say this now because I'm not going to stay for the whole meeting. But we just had our meeting with the circuit court judges the other day, and they had nothing but praise and compliments to Deschutes to behavioral health and what an amazing job we do. You all do. I just had to say that. And Captain Schultz, of course, was complimented profusely about what we do. And apparently they did do someone was asked how many people in our jail. Remember that study that 92% of the people in the 232 people in our jail, 92% of them were substance use disorder and or mental illness. Well, apparently nobody that has been surveyed could come up with the right answer. So, the issues are way higher, but I want to thank everyone for what you do. Please keep doing it. It's a huge calling.
Thank you for saying that. We really value our partnership with the courts. It's such a critical piece of our work, and we're really lucky here in Deschutes to have such good partnerships with law enforcement and the courts. That's not the case everywhere, so we're grateful for that.
Yeah, thank you, Holly. Thank you so much.
Thank you. And I'm Roger Olson. Sure. Okay, I have a motion to approve the minutes of the August meeting. Then September.
So moved.
Second.
Okay, thank you. All in favor?
Aye.
Okay, thank you. That's done. Move on to director's report.
So feel free to ask me particular topics that you're interested in, but I'll just give a yes.
I want to know the Jackson project, Jackson Home. House, Jackson House. Exactly what is that? Because Commissioner Chang and I were talking different ways, and I need you to clarify that for this group because it is so important.
It is so important. So for those of you that are familiar with the Deschutes Recovery Center, it's essentially another program like that operated by a different vendor. So it's a 16-bed secure residential treatment facility that we did. We sent out for a request for proposals. Jackson House was the recipient of that award. We received $2 million from the state to pass through directly to them. Obviously, $2 million does not build an SRTF, a secure residential treatment facility. So we were fortunate that Jackson House comes with their own resources and had actually already purchased or started to purchase some land in Redmond next to the hospital. So that is the planned site. We have not signed the contract yet. It is in the works. We're back and forth on the contract, but I'm not worried. So it's not totally final yet until that contract's signed. But as soon as that contract gets signed, the hope is that they'll start breaking ground, and 18 months from now, we'll have another 16-bed facility in our region, which is huge because we have.
Who is it going to serve?
It's going to serve people under civil commitment primarily. That is at least for a period of time, because the $2 million that we were given from the state was earmarked for folks under civil commitment. So the facility has to serve people under civil commitment for at least the first year or two. After that, it may morph into serving aid and assist, PSRB, some of our other significant populations, but right now it will be solely civil, which is wonderful because right now the issue we have with civil commitment, as you all know, I've griped about this 100 times in here before, that we get them civilly committed, which is an incredibly high bar to have somebody get through that process. Once we get them there, they get stuck in Sageview or Pez at St. Charles, which is not a place where people are supposed to stay long-term. There comes a point in time in which St. Charles cannot do that any longer. They've met maximum benefit. They sometimes will get discharged to homelessness in our community under civil commitment, and that is an atrocity that should never happen. And so because we don't have enough facilities in our community, we have the one secure residential treatment facility. It serves our region. It is full all the time. It's right next to the stabilization center. Yeah, so it's on the public safety campus. It's been there for 20 years. We love them. It's a wonderful resource. We need probably 3 more of them. But to get another one, it's huge for us.
But then the other issue is this, you're hearing the 16-bed number, and that's really the problem because that's from 1963. I'm sure you've heard me talk about this, rant and rave about the 16 beds. It's not cost effective. If we could even do 64 beds in a facility, can you imagine the difference we can make? Senator Wyden really needs to hear from this group over this issue.
Yeah, I agree with you, Commissioner. I think we need flexibility on what those facilities can look like, and there is a lot of opposition that I encounter whenever I have this conversation. It seems like, especially at a federal level, we are running into this. There are communities across the state that are trying to build stabilization centers, and they're trying to build these campuses to support this population and build a continuum. And they're running into a federal law from the 60s,
1963,
referred to as the IMD waiver, which does not allow certain types of facilities or populations to be on the same campus, and limits the size of those particular things. And it's all because of institutionalization. So this all stems from the days in which we had asylums and people got stuck in there for their entire life. And so it's then the pendulum swung way far the other direction, and now we have these restrictions that don't necessarily make sense anymore. And so it's trying to find a reasonable middle ground where, yes, we don't want to institutionalize people for their entire life. That's not what any of us want. And what's the magic number around 16? What is it? How is that changing that? So those are the conversations.
I see that Leah has his hand up.
Oh, sorry. Yes, Lee.
Sorry, Lee, I forgot to introduce you guys you and Paul are up there on the board.
Hello, hi, my name is Lee Butler. I'm at Ben Treatment Center, board member. If I'm out of order with the rules, correct me, Roger, but this sounds like a good thing for us to take up with the advocacy topic and letter writing we talked about last month as well, just in terms of finding a place to start, just as a thought for how we can, we got Wyden from Commissioner Adair. We got somebody to write a letter to. It's a starting point.
Yeah, I think there's real opportunity for this, I mean, and I think there's gonna be some things that come up from a state level around this, because there's a facility in Wasco County and there was a facility in Klamath County that are stuck, not able to be built, not able to move forward, even though they have the funding and the momentum, and they can't move forward because of these federal regulations. So I know those communities are really, really frustrated right now, and likely gonna be wanting to bring things to the legislature. So that will be something we'll pay attention to.
If this is a federal law that's implementing this, then I'm going to assume that this isn't Oregon's not the only state either. Is there any federal organization to try and address this, or how is?
Well, the federal organizations that I think of, like SAMHSA is one, and the National Council is affiliated. It does a lot of policy advocacy work at the federal level in Washington. And so, you know, again, though, this is one of those topics that I'm not sure everybody's on the same page with. You've got your folks that are really entrenched in ensuring that we don't re-institutionalize people for their lifetime. And because of that belief, that an understandable belief, they double down on some of these restrictions, and then you've got sort of the opposite end of the spectrum that wants to open it all up, and then that does lead to some potential abuses of that.
How do you get them to the
How do you
table?
get people to come to consensus around this topic? It's been tricky, but I think if this board were to want to get involved in that discussion, I think that makes a lot of sense.
Okay, bringing back historical fact for the state of Oregon, there were thousands of people that were initially institutionalized when our population was, what, 1.2 million or something? And the stories coming out of the state hospital are horrific. But yet the stories that I've been told by friends that actually worked in behavioral health is that the facility in Pendleton, the state hospital that was closed in 2014, actually did a really good job. They did a really, and I'm going like that's where I was born. So I'm like, they did. I never really knew that, but we've got to find that happy medium. And then I know like Tenet Healthcare owns a private mental health hospital in maybe Southern North Carolina. It's private. It's like 84 beds in that facility, but it is a private facility. And that's how they get around that rule, but it's very cost effective.
Well, there's a lot of states that have got waivers from that.
Yeah.
From doing that. And about 6 or 7 years ago, it seemed like there was a real movement to get away with abolish that rule and kind of.
Well, our county legal actually looked it up, and we could do like 16 beds on different lots with the same area, but then the building cost would probably be a bit more because you're not sharing walls. But we could do that if we could find someone who wanted to run a bigger operation. And of course, we'd have to find more funding.
Right.
Okay, so now you're telling me that Jackson House is not for children.
So there's two projects with Jackson House. There's this SRTF that is for adults only under civil commitment, and that's a 16-bed secure residential treatment facility. We are also, as a region and our acute care council, working with Jackson House to develop a child psychiatric facility. They recently opened one in Idaho Falls.
Right, that's what I was talking.
So it's the same company, two different projects.
Okay,
And
so
the one with the SRTF, that's very specific to behavioral health. We got that one going. We got the contract. We got the money. That one's moving ahead. The child psych facility is really a partnership between, St. Charles, Pacific Source, us, Crook and Jefferson, and like, how do we as a region get this project off the ground? And we don't have any money identified for it. This is the one we talked to the legislatures about when they came to tour, hoping that maybe in the long session we can secure some money for a facility like this. Because even though Jackson House has resources to be able to build it, they don't just come in and build them. They want commitment from your community. They want buy-in. So they're going to expect some sort of contribution to go towards it, land or something. And so those have been the conversations. We had hoped St. Charles might have some land that would be available. That may or may not still be something we're able to explore, but we're moving forward. The tricky part with children's psychiatric facilities, the regulations are incredibly large. Like there's a lot of staffing requirements. I mean, understandably, as it should be, but there's a lot of requirements. And in this environment with workforce being what it is, those are some of the hesitations that Jackson House is having to kind of work through, because staffing's a reality. Staffing challenges are a reality for all of us, and you don't want to open a very expensive facility like that if you aren't going to be able to staff it fully.
Well, look at the childcare at OSU Cascades. We've helped fund, and they were down to 2 employees. Childcare. I mean, you just cannot make this up. And we actually had given money to St. Charles for childcare, and they returned it. They did have some land there, so maybe we could, they were gonna do the childcare on, so.
So the conversation, the child psych facility still, it's also happening at the children's system care level, like it's been escalated up to the state level. We are very much pushing that project as hard as we can, but without resources, those become uphill battles. But I feel good. I feel like we're making some headway on that project, and that in the next year or so, we might have either some resources come our way, because that study that was just done around residential capacity for our state, that's really kind of been at the forefront of a lot of legislators' minds. So I'm hoping some funding comes out of that.
I do have a question. So what is you talked about there's groups that are fighting it and others, what is the main group on the other side? Is it Disability Rights Organ?
Yeah, I mean, not even,
I didn't know if
that's
there's
just the local, that's just the state Disability Rights Organ.
Oh,
They're, a wonderful organization that really does work to protect the rights of people with disabilities. And they're often at the core of why we can't make reasonable changes to civil commitment law, to these sort of requirements around residential facilities. And it's this pendulum swing, right? Like their goal is to protect rights. They don't really think too far beyond that. Like that's their mission.
We come into, we have problems with that, with education as well. Like, they have a class action lawsuit against Oregon Department of Education. And we can't reduce or shorten a student's day without, it's insane. And some kids can't do a full day. They just can't. And so they're sort of like a one-dimensional entity that.
One size fits all.
Yes.
Yeah, and that can be really, and they're very, very powerful group in the state. But this is federal, so it's really more federal disability rights organizations that are really like that. The history around all this is
Isn't that Bazillions, something Bazillion Center or something that leads that?
Right. Yeah. So I mean, it's a big conversation, and we just spoke with somebody from Wyden's office about this the other day, and I didn't feel like we got like a rah, we're behind you, we'll help you figure this out. We got a explanation of why this would be incredibly difficult to undo. And I think we've got to keep talking about it. These laws from the 60s are really problematic. Yeah. Civil commitment laws are same.
We see that in California too.
Yeah.
So I have a question, Wyden, I'm a political neophyte here, but what about Merkley?
Yeah, I mean,
Well, I'm just saying, Wyden's office actually has been working on this issue. Last November, in fact, I was having a conversation when I was at the AOC conference with the staff in DC, like, please, folks, this needs to change. 16 is just too small. Even 32 would be better, right? Even 32, but you think the number of people that need to be committed, when you see the number of people in our jail, 92% have mental illness and or substance use, it's really, there's such a need. And you wonder, you really, you want to dig deeper and find out why.
Are there any untapped resources that could get into the conversation with us?
I mean, I don't know how much NAMI's been.
NAMI's been pretty, pushing it pretty hard with Wyden. Wyden's a really good friend of NAMI. So I know, in years past, it almost looked like something was going to happen.
Yeah, that would be a group that I think would be wonderful to partner with on some of this work. And I think, that would be an avenue.
That would be great if we would partner with them, honestly, because, it's got to happen.
Have we been connecting with the school districts? Because I know some of the regional school districts might have some land available. If this is such a dire need for a center, that anything would, I don't know if I'm just saying we should be talking.
We have not explored whether the school has land to offer towards this. I do know that Jim Bowen is on the System of Care Executive Council, which this has been discussed there. So he's certainly aware of the project and the momentum towards it, but I've not, that's about the most I've had of engagement with the school on this.
geographically, we're just talking to Deschutes County though, so it could conceivably be in Sisters, Redmond, or anywhere.
But I mean, it would, these kinds of facilities are really statewide. Like it would be in Deschutes County. We would want to make sure our people are prioritized, but whenever you open up facilities of a certain license and classification, they are required to take people from all over the state, which is another problem that sometimes gets tricky.
We desperately need to serve our side of the mountain because, you know, everyone has to send their children now, to Portland, basically to Portland. And that is so disruptive for everything. And at least if we could do it here, it would help at least half the state considerably.
It would help Klamath, it would help us, it would be a regional, I think it would mostly be filled with people from our region. I really believe that because we've actually done the data mining on this and we have enough folks that we think we could really make use of this facility.
And the other thing that we are so fortunate to have is the Kids Center, because that actually serves this side of the mountain too. You know, there's like 17, 18 counties that use the Kids Center, and you know, their expertise and the quality of care there is just, you know, outstanding. So, you know, we've got to get that. We've been asking for it for a couple of years, and it's at least 10, 20.
Yeah, 20. Yeah, it's a need. I think there's nobody that disagrees with the fact that we need one here. It is, we have an organization that is well equipped to do one here, that's interested in doing one here. So that's a step in the right direction. So we'll keep working on it, and as the session starts and we have opportunity, there was a bill, you know, last session from Rep. Sanchez's office around creating regional child psychiatric facilities. We still think that would be a good thing because that might allow for some funding that might come, and our region was certainly identified as one of the areas that would benefit from that.
I'd really encourage you to touch base with the superintendents, you know, just because this is so critical in my world and special education, and we're getting kids. We've got a couple of group homes, for example, in Redmond. And I'm going to be really nice on my comments today about it, but they bring in kids from out of the area and then they dump them in Redmond School District, and they're so high needs that it's like, we can't staff them. I mean, our staff is getting hurt. I mean, we had a concussion last week. I mean, just really bad stuff. And there's no, you know, when they come in and land in Redmond, there are kids, or Redmond School District's kids. And so this is a topic that is probably one of the highest priorities in all school districts that I serve, and I serve probably 13 of them. So if you need support, and then there's, you know, I just think that that's a connection we should be making.
I think I'll reach out to you outside this meeting and maybe see if you can get a representative at the Acute Care Council from the schools, because we have basically taken over our Acute Care Council venue to work solely on this project for the next however long it takes. And we are putting aside all other issues and working solely on this. And so having a rep from the school could be really helpful. So I'll reach out to you. Thank you.
Actually, getting that land could be really a great first step if you all have some land somewhere.
I'm not saying anything.
I heard you have land.
Right here.
I'm not talking about Bedlam Line. I also represent Sisters, and I know they just built a new elementary school, and they have that old elementary, so they've got some stuff that they're doing. I don't know if we have land or not, but I'm just.
No, you do have land. I mean, they ask us all the time about, you know, we've donated land to the school district and then they're going to do something with it. So then they come back to us and ask it if it's okay. So yeah, I know you have pockets of land.
I don't know. It's one of my districts. I don't know. Maybe.
How many acres did you say we land? Yes. Did you say like 2 or 5 acres? Yeah.
Well, so I won't take up any. I mean, we have all kinds of stuff going on. Space is of a major priority for us right now. We are exploring all sorts of options to just make sure we've got adequate space to do the services we need. And then we are also in the middle. The county is in the middle of doing a wage and equity study. It's underway. The information is coming out. So our staff are really busy making sure our positions are classified correctly, that we're comparable to other places in the market, and really doing a deep analysis on that. So that's big work that's underway. And then in addition, the state was required in the last session to do a cost analysis of civil commitment, aid and assist, and crisis services. They were mandated to do that by January of 2025. They, of course, in true state fashion, took 6 months to get it underway, and now we're all in a scramble. And so I had to cancel my whole week to try to work on this stuff, but it's really, really, really important work, and it's really frustrating, the timelines we have to get the data to them, but essentially the goal is to truly, for the first time ever, cost out what it truly costs the CMHP to provide civil commitment services, crisis, and aid and assist. The way the state has funded us has been just like, oh, you get some money, I'll give you this money, and we have no formulas, there's been no rhyme or reason. They've RFP'd things out in the past. Some counties fared well, some did terrible, and now it's an attempt to sort of make it right, at least with information to say this is what it costs, and then there can be advocacy in the state legislature to say this is the amount of money we need because we did the work to know what it costs. So it's really important work. I hope the data they get is good. I'm a little nervous in terms of the timeline, but that's underway. And then next year, they will be working on the rest of all of our services to cost those out, and that'll be a humongous undertaking, but they'll have a lot longer to do it. So, yeah.
Big stuff.
That's a lot.
Yeah, I could go on for like 2 more hours, but I'll stop there.
Thank you.
Thanks.
Ashton had to step out quickly.
Anyway.
You want to go ahead with
Yeah.
the introduction?
Ashton Veneer is, and I'm gonna read it, the DEI strategist for the county. And she was invited to give an overview of what the county is doing regarding inclusion for everybody. She can talk more about that. But the reason I wanted to introduce her is this grew out of the discussion of last month regarding the letter that was provided by Max. And so although she's not going to be talking specifically about the letter, she's going to be talking about the county's efforts in this process. And then after that, we'll move towards talking about Max's letter, moving to some hopeful consensus and a vote, or discussion and a vote on the outcome. So this is kind of the broader view of what the county does, and then we can narrow it down more specifically to what happened with this letter and how we want to move forward. So that's it. Anything I missed around that, Roger?
Sounds
Yeah, just that
perfect.
she won't be speaking to the rat card or anything.
Oh, that's right. She won't be speaking to the rat card. We will take that discussion up afterwards. So.
But we can't do that until after.
Yeah, but
Maybe here in just a minute.
we want to continue the discussion until she gets in.
Any other questions for me?
I want to just throw out there something I should have put up in announcements. I watched, I think it was 2 weeks ago, board meeting where Dr. Christensen updated the situation of fentanyl.
It was a 75-minute presentation, if you can go back and watch it. Oregon has gone from being like at the bottom of the nation for accidental opioid overdoses to we're now at the top. And the good news is the medical examiner's numbers are coming out almost instantaneously compared to like 2 years after the fact. Horrible change of venue in our state with what that presentation. So it's a 75-minute presentation that was
It was a long thing.
Good to get that maybe.
He said it very slowly, but honestly, what he was saying was so impactful that, it's just like when we had the marijuana presentation, I had an employee say, oh my gosh, I never knew all those dangers of marijuana. Nobody gets what's really going on. It's like what the judges said. All the complications, the THC now that's in marijuana, it's so dangerous.
Yeah. But he gave us a great, presentation a year or so ago on how we got here, and this is just an update of it. It was interesting. I had to watch the whole thing.
If you happen to have a timestamp for either of those two and could send that to us, because
Yeah,
I
that
know
would be great.
to
You know, I
search
was-
through is a little hard.
I know.
If it's still up on your computer and you could
Yeah, if
send
you
it to
could
us,
do
that would be
that.
awesome.
It's still there, and I wrote it down on, but I can't remember what it was.
Would save us the
when it
searching.
started, and that's,
Yeah,
Yeah.
that
I
would be
figured this would
beneficial.
be an update.
Thanks,
in the
Roger.
last 20, 30 minutes. Just kept going.
So Ashton, while you were out, I introduced you.
Oh, wonderful.
And I just kind of set the parameters for your discussion.
Awesome.
And, so there you go.
Okay, I had a little introduction myself too, so what did you
Good.
say? What did
I
I
just said, I had to read exactly this.
I don't want to get
And
embarrassed.
that how you were going to talk about how the county is reaching out to diversity, and that we'll discuss the RAC card after you're done.
Thank you so much, Jessica. So, hi, I am Ashton Varner. I'll introduce myself a little bit and we'll jump right into the committee stuff. So I've been the DEI strategist here at Health Services for about 14 months now. My family moved here August 2023 and I started the job August 2023. That's what brought us here. In my role, I serve our entire organization, so behavioral health, public health, and admin. And my role is housed within admin, specifically on our compliance and quality assurance team. Before moving here, I was the houseless coordinator for the County of Kauai Housing Agency in the Hawaiian Island chain. And while there, I developed a queer business directory called Equality Kauai. And before that, I lived in Fairbanks, Alaska, and did community work there with AmeriCorps Vista. But way before that, I was born and raised in Alabama. I know I don't have too much of an accent. You get on the phone with my mom and it'd come back up. But yeah, that's where I grew up, Roll Tide. My mom was raised in Oregon down near Eugene, and I lived in Portland about 2015 to 2018. So that's kind of how I got back here. Our committee. Yeah. Okay. Dana sent out the our first ever annual report via email, and then we do have the physical copy going around. And then as I was making these notes, I thought I'd also share with you our kind of one-year DEI action plan here at Health Services. So our committee meets monthly. We meet for 90 minutes. It's been meeting for years. My dream is that one day I'll have our entire history, or as close as I can get to it, all together. The furthest back record I was able to find was from, I want to say 2014. So a decade's worth of some level of work happening within that committee. And the way we function, we do have independent projects, but a big part of what we do is provide guidance, ideas, and feedback to programs and staff. So for instance, the behavioral health client satisfaction survey came through our committee last month to have it was pretty well buffed at that point, but we gave it another review. So typically, the way that actually happens, someone reached out to me directly as a strategist, and I said, let's take it to the committee. So the committee is really crucial in this work, even though we do now have a strategist to still give us those different perspectives, different lenses, and help us catch everything we can for those topics.
Shirt on that side.
Kind of jumping into what you'll see in the annual report. I won't go over every single bit, but some of the highlights. We're currently at 14 members, which probably looks a little bit different on there. We've had some shifts. And with membership, we aim for representation across our kind of branches of public health. Public health, behavioral health, and admin. And then we also look for a balance with official management roles and non-management roles, or leadership and not so official leadership. Anybody can be a leader, so don't like that phrasing always. But yeah, and that still helps us balance out the power dynamics and helps us have different focuses. Even within public health and behavioral health, people are on different teams, adding those different lenses. So that's huge for us. Last year was, going to go into budget. Last year was our first year with a budget. We were able to spend 13%. This year I hope to spend much more. And we did go into this fiscal year with an itemized budget to help us guide spending with 4 categories that when I get to Q&A, if you really want to hear, I'll remember those. But we have more of a plan this year moving forward, so we're excited about that. We were jumping into trainings, able to offer 3 distinct trainings this year. We always have a welcome week orientation around DEI. That's primarily new staff. It is open to current staff, but that's a little less well communicated. So one of my goals is to communicate that better and see if that shifts anything. It's a real 101 plus what we do have here at Health Services, kind of introduction for our new folks. They go through a lot of stuff at Welcome Week, which is a 5-day, Amber can, 5 days of really 4 days of just health services and 1 day of central HR and those kinds of orientation things. So it's a big, long week, so we try not to give them too much, but a good base so they know where to look for certain things as they go through their time with us. Committee members are also encouraged to shadow and help lead that. So we do have some current staff members in that capacity as well.
Is that welcome week just for health services, or is that the county?
It's health services. We started it, gosh, Amber, what was it, like 10 years ago, maybe? And it was really an initiative that was just based off feedback from new employees that were feeling overwhelmed that coming into it. We were getting bigger and bigger. And so it was, I think it's been one of the better things we've done here in terms of onboarding staff. It's robust. It really helps them develop, collegial relationships with people that are also coming in at the same time. They hang on to for their entire duration of time that they work here. So it's been really great.
That sounds like a great idea.
Yeah, that one came from our workforce development committee. Yeah.
Another training we were able to offer through a Pacific Source grant was our Native American Strength and Resilience. We brought in, we contracted with a facilitator, and that was open to all staff across those branches. And we were able to offer it 4 times, and our last opportunity was in La Pine, and it was open to community partners as well. Impact of bias on mental health in BIPOC communities also came out of that Pacific Source grant. It was also open to all staff and external organizations, and that one was an all-day training. Then the 4th one I have listed is based off of this book, Anti-Racist Ally, a deep dive that we offered to leadership in a condensed online format. So that's what's in the annual report that you see, and I'll talk a little bit more about that later on, kind of how that has expanded into this current fiscal year. Still kind of staying with training, we have an annual equity training requirement each year that is actually live right now. It happens in the last quarter of the year. It's alongside things like HIPAA, bloodborne pathogen training, wildfire safety training, just those requirements at the end of the year. We responded to feedback from the last quarter of 2023 that the option that was on there wasn't, people were kind of over it. They wanted some different options within that, as well as options throughout the year to complete that. So in April, we were able to go live with that year-long option. And then here towards the end of this year, we revamped our end of the year offering to be better. Long story short, to be better. It's a topic I can go on, but it's a little less interesting. Just talking about developing PowerPoints. So that's kind of training for us from the annual report. Moving into our employee engagement survey that happened last year. That is another big thing that came out of our workforce development committee. Shout out Amber. So we had a section specifically on DEI. We provided definitions on those 3 terms for our staff who were taking that survey, so that hopefully what we're trying to do was be sure that we were looking at it from the same baseline and the same lens of really what is the equity and inclusion, because sometimes those words have multiple meanings, multiple, kind of depending on how you're focusing on them at that time, and different situations and perspectives. So wanted to try our best to create that baseline. From those results, we had some takeaways toward hiring, recruitment, and retention, going into a welcoming and non-discriminatory environment, as well as the actual practices of hiring and different methods you can use to reduce bias there, and also offering more trainings. So in this fiscal year, so you won't see it on that report, but Workforce Development hosted a pulse survey that wrapped at the end of this September, so we've got results pending on that, but we look forward to seeing how things have shifted in many ways. There's a lot in there that can inform DEI that aren't even specifically those questions. So it's a really good tool to have. I'm going to move into our subcommittees. Those started in April, and that has been a really, really big game changer for the committee, empowering folks to be able to really get their hands dirty with things, especially because initially when I came on, our meetings were only 60 minutes. So it was a lot of updates and just me talking at people, similar to right now. A lot of updates and me talking, and I was like, no. So it's hard to dig into things, and it still would be hard to dig into things with a group of 14 people in 90 minutes. So we now have our 3 subcommittees. They started up in April. That's training, engagement and activities, and resource development. And in that time, it's kind of funny because big efforts of theirs have all come to a head at about the same time, here in this month and then in next month. So our training committee updated our Welcome Week presentation I mentioned earlier, as well as our annual training. And those went live this month. Engagement and activities brought a pronoun pin program to our staff. So we have bulletin boards in all our brick and mortars with some information, as well as a basket of pins. And then our resource development committee is developing a DEI glossary, which is required by public health reaccreditation. So we prioritize that, and we hope to go live with that next month. So doing really good things. I'm hoping it is empowering our membership, and then also, of course, helping our staff. So it's really going the spreading across in that way. Another thing that we added are community updates to each of our meetings. So what I mean by that, members who are already engaged with a community, a grassroots organization in most cases, provide updates from that community or group that they're working with. So as of this month, we receive updates from the Fathers Group, which focuses on the Black community, Latino community association, Out Central Oregon, which is LGBTQ community, Homeless Leadership Coalition, Central Oregon Disability Support Network, the Human Rights and Equity Commission through the City of Bend, as well as the countywide DEIA committee. We've also gone deeper with our communication to staff. So when I started, and maybe Holly, Amber, Dana could speak to how long we've had the diversity calendar come out of the DEI committee. Long time.
Probably what, like 4 or 5 years? I was just gonna say that.
It's long to me.
Yeah. Depends on your perspective.
Yeah, that's an all-staff email that goes out monthly and highlights the different cultural celebrations, events that might be happening. Just a variety of stuff. Left-Handers Day, Black History Month, in this last quarter of the year, lots of stuff from lots of cultures happening. So that's existed for a while, and then this year I added, as the strategist, some heritage highlight emails for those.
Responding to take that.
Talking about us.
No, it was not that. Thank God. That would have been embarrassing.
Myself. So,
I've learned not to put anything negative in chat because
that happened. The mic was live.
right. So these heritage highlights differ in that they focus specifically on, say, Black History Month, Women's History Month. We did Asian American, Native Hawaiian, Pacific Islander Heritage Month, and then Pride Month for the queer community in June. So they just focus on that culture and offer some origin, did you know, some short videos, things like that to engage with, as well as we've added PDFs so people could print and post if they like, desktop wallpapers to show that kind of recognition and solidarity. And then beyond maybe some of the obvious diversity things to highlight, in August of this year, we also did Left-Handers Day, because left-handed folks experience the world, this righty world, in very different ways that if you haven't needed to or been exposed to, you're not gonna think of. So wanted to highlight that, and I did get several employee emails back saying how seen they felt. I didn't expect that. So that was a fun one. And then with the other 2 communities, committees, we have started a quarterly newsletter with our updates to send to all staff. We also turn that, or it is a PDF, and we get that one translated into Spanish as well for our staff members who prefer to read that in their native tongue. In terms of, well, what's the strategist do and what's the committee do? Great question. I don't have a quick elevator speech for that, but I do have a couple of things to point out that have been more strategist-led than necessarily committee-led. There's a lot of overlap. But in terms of this book, Anti-Racist Ally, which I brought, so I can pass around for those who are interested in taking a peek. We offered that book, and feel free to flip into it to kind of see the format, which is helpful. There's a lot of anti-racist books or diversity, equity, inclusion books or whatever that are gonna be like chapters long, which is great. But of course, I'm like, my staff doesn't have like that. There's gonna be a few who can, but is that really what the best movement forward is? So as you see this book, it's really broken down into bite-sized chunks. Again, I think I mentioned before, we want to create a baseline understanding that this is what we mean or what we're familiar with when we're looking at these topics. So December last year, we offered the book to leadership, and that's from supervisors up to director. From March to April this year, we offered an online deeper dive program to same leadership group. And then in June of this year, we began a 4-part series with leadership that are 90-minute sessions within their every other month supervisor manager meetings. So as it's developed and been exposed to more folks, we've shined it up more, which is always great. And then we've also seen how we kind of want to proceed with this and the reach it's going to have. So we want to be able to offer this to all of our staff. But before we do that piece, we wanted to start with leadership. We wanted to equip them with the knowledge of what's in the book and also help prepare them for conversations that could come up from the book. So yeah, this month was number 3, December will be number 4, and then we'll be moving forward with a plan to offer the book to all staff and then consider what programmatically that might look like to offer it to 450 people, which I'm ready for the challenge. But yeah, that's a lot of logistics. All right, my very last little piece is our 1-year action plan that Dana passed out. So full transparency, a big part of developing this was to help guide the strategist role as well as the committee role. DEI is a humongous topic, and that's not even including all of the letters. Sometimes you'll see belonging, justice, and access. So it's a lot of stuff. So how do we kind of narrow in our focus? It's going to help me spend my budget better in the committee, as well as, just helping us focus in on some things. So we've got our 4 categories: professional development, accessibility needs, welcoming and belonging, and internal DEI strategy. Each of those have a few 3 to 4 action items on those specifically, and then I'm always looking for ways to incorporate this or tie things back to this action plan. And then ideally, from kind of that category number 4, internal DEI strategy, we will have a long-term strategy, 3 to 5 years, that really has deeper connection into all 3 of our branches, all of those teams that they connect with, ways for them to tell us how they've been contributing. But for this first year, it's a lot of direction for strategist and committee. That's what I got for y'all. Thank you.
I have a question.
Yeah.
Are you the first employee of this DEI?
Yes.
Dedicated to position?
Dedicated to this. Yep.
And you got your admin from a borrowed position?
Oh, yeah. I was like, she's right here. She's your admin. Yes. Yeah.
She's our gift.
Dana is everybody's gift.
Well, yeah.
Holly, write that down.
Thanks, guys.
Thank you very much. Any kind of broad questions before we move on to our specific subject?
That's a great background for what we're doing.
Can I just make a comment? Just congratulations, because it just sounds like such an uphill battle to really bring infrastructure to such a broad topic. And that's so cool about the Native American training, because it looks like it was the most well attended.
So good.
So
Yeah.
So good.
Yeah.
So I love that.
And that was the benefit of offering multiple opportunities. It was a 90-minute training. So we did multiple opportunities, multiple locations around the county to serve our staff.
Yeah, it shows how hungry people are to be empowered with more knowledge. And then just for your, I guess, in the spirit of collaboration, like St. Charles has really struggled to get the kind of infrastructure that you're getting to our DEI committee. And they also added B for belonging as well recently. But we are making momentum with trauma-informed care, and like DEI definitely trauma-informed care. I don't know if if it's like an umbrella, like which one is broader or whatever, but they're all very interrelated, trauma-informed care and DEI. And we reached out to Arctic, the anti-racist trauma-informed care team. And so we're in the process of really trying to like rebuild. And it's just, it's kind of encouraging to hear the progress that you're making. So thank you.
Yeah. And I don't gatekeep. So anything you've got in there, share with them, reach out to me. Yeah. This is everybody's work.
Yes,
No kidding.
I would like to provide feedback too, because I'm retired from Sacramento County, but now I work with providers. And through their cultural, they call it cultural competency, which is probably a little outdated, but that's what they call it.
Use humility now.
I'm
Yeah,
gonna
sorry,
no,
hopefully
thank
that
you.
tone was fine.
No,
Yes, there
no,
has been a
I love
shift.
that tone.
There has been a shift. It's moved.
We have the providers, not the county employees, but the providers, of which now I am that side, are required to do 12 hours of training per year. But the training is not expansive. The training doesn't get into that pink book. The training doesn't get to actually, the first year was good because it was like giving some cultural perspective from members of that community. That was good. But then the second and third year was the same. But how do you put that into practice? How do you change how you serve people? So I may be giving you a call as well.
Yeah, please do.
Thank you. And the first year of developing anything is just a lot of work. A lot of work.
It's fun. That's been a very supportive environment in general, and then for this work, and you got to have support for this work to actually do anything meaningful. 2020, it became popular. Now it's being defunded in a lot of spots. And if you don't have the support, the backing, and we do have a budget, which can also be very, very huge, is very huge, that actually literally puts the money where the mouth is. So this is also a good group for me to mention those trainings. Two of them I mentioned offered CEUs for our behavioral health, through NASW. So anybody that would apply to, but obviously that's heavily our behavioral health staff. And so that was important for us too. We try to do that every time we can. Our budget goes towards that, and our committee, our budget can go toward those CEUs. So try to sweeten the pie as much we can. So I know people want to, but getting away from the office and the clients and everything, we can offer CEUs makes it a little bit easier sometimes.
Yes, way easier.
Yeah.
Thank you very much.
Thanks, Ashton.
You're welcome. I'm going for the food. I'm gonna make my plate now.
Very much. Okay, so that kind of gives a broader framework for what the county and what they're doing and their commitment towards DEI. And I'm very bad with my pronunciations, as you all know now. So if I messed up any of those letters, you know where to refer. And so at our last meeting, I'm really not sure how it organically came up, but it became known that our RAC card had the flag, diversity flag on it. And we had a youth representative from Patty Adair's office that was here. And after the meeting, he offered a letter that did not go out to anybody. And in hindsight, that was a misstep on Roger and my behalf. And those types of things won't happen again. So I hope that that can be kind of bookended, voiced, discussed, and apologized. But the action item behind that was to then take a deeper look at how this group actually felt about the flag on or off of our RAC card. And for those of you who are newer members, our RAC card was developed as a method to have, may I touch this? Put out so people could pick it up and see what the advisory board was about. And the piece that was put in the back that the Max is his name, had some feedback on was this piece here. So I took a look at Max's letter, and he's articulate, much more than me, but I highlighted what I believed were the issues to discuss, all right? Rather than write through his personal opinion about stuff, I pulled out what issues were, okay? And if that's okay with you, I'll read the highlights, and then we can open for discussion and hopefully come to some kind of conclusion and a vote, okay? So basically, his first sentence was how he was impressed with us, but we like that. The second one is, I will read, I noticed that you included the LGBT plus flag in your information flyer, which is a wrap card. I'm a large supporter of the freedom to express oneself, and that any given citizen should be able to choose to marry who they like. I have many friends and family members, et cetera, et cetera. However, I have concerns about the presence of this flyer card on your flyer. Okay, so that's his statement. And then he spoke to, mission alignment. He said, placing this flag in large print indicates a couple of things about your mission. Primarily, you serve LGBT plus individuals. The organization focuses on advocacy for this community. Or are you affiliated with the LGBT plus advocacy group? Fair statement. One sentence from the next paragraph. From the information I learned from the board members and reading through your bylaws, there's no mention of this being a primary focus of the LGBT plus members and community. The rest is a little fluff. Next sentence. If you are trying to stand in solidarity with this community, it should be done through actions and not through a virtual signage. Okay, the rest was fluff, in my opinion. So, and if you want to see, I'll pass this around. If you want to read the
Email it
fluff.
to everybody.
Okay, so you can read the fluff. Maybe there's stuff in there that you don't think is fluff. That was my. So go ahead, Linda.
Oh, I don't want to interrupt you. I just
want
in line for comments.
Okay, so I just want to kind of open that up, and just for background for newer people, Roger and I read the letter and I said, okay, that's not a big deal. Okay, take it off. I mean, there's some logic. Some of the group had expressed some feelings both ways. Some of this group said, no, we need to keep it on, et cetera, et cetera. Some of the group said, well, he kind of has a point. So, and I have my own opinion, which is just one of the votes. So I don't really need to put that out there. So at this point, I would open it up for discussion, and hoping we can do some discussion, and then we can make a motion, and then we can vote on it so that we can have a moving forward. And because there's so many other important things to do, like our subcommittees and getting some type of advocacy plan, so I see this as an opportunity for this board to move forward through resolution and agreement within today's meeting. So open up. Yeah.
Well, I'm the newest, I know that, but I did sit in on, Zoom in on some. And I'll give just a tiny bit of my background, which is a context. I used to be an organization development consultant.
Just a little bit.
Sorry, I'm guilty of that. In my former life, I had a practice as an organization development consultant. And so I worked with counties, public, private, Fortune 500 companies, yada, yada, yada. And part of what I did as a trademark, not being an ordinary management consultant who was just for money, and I'm not judging, I'm just saying I didn't, was to look for the win-win. Really push for the win-win when we had opposing heated conversations. So I tried to look at this in context, and I've looked at it every day since the last meeting, because this is really on my heart. I believe that from what I've read, these cards should stick to our core mission, and we can't be everything to everybody. And I picked up in the last meeting a little, and then just out in the world, I don't think there's a win for putting any flags on here at all. We can try to put every flag that exists. If we had the ability to conjure up every flag that exists as of 2 minutes ago and put them all on here, okay, or a link or whatever, we could do that. But more organizations are going to come up the next day, and people who like to start fights are going to say, well, you've got 72 flags on here, but you don't have ours. And I believe that, and I know I don't have the right answers, this is just my heartfelt opinion. If we want to look at behavioral health, avoiding something that's going to start a fight is probably healthier than trying to be everything to everybody and then have the naysayers come after us. I think it'll take the focus off of what I've read here. Okay, end of sermon. Thank you for listening.
Lee had his hand up.
Oh, go ahead, Lee. You're on, Lee.
Thanks. You guys can hear me okay?
You're a little scratchy. I'm not sure what
It's
the. Oh, it's us. It's not you. We've heard this before.
All right. Well, yeah, I appreciate the points. I appreciate the acknowledgement of the process error before this. And I think moving forward with that resolve is going to help a lot for these. My thoughts on this, we're advising the county on behavioral health, and we need accessibility to care is a thing we've all talked about. And the thing we need to make sure we're at the forefront of, whether or not the imagery we use, that's something we should think about, but and consider. I don't see, I could go either way on if the flag is on our card, but we have to maintain a focus on access. The specific flag in general is a population that completes suicide at such a degree they don't even use certain metrics because they've been known to be, especially teenagers, to complete suicide at incredibly high rates. And we have to be able to be inclusive. And we're guiding and advising a government agency that's about inclusion. And can't miss that in what we do if we choose to not have subtle imagery encouraging inclusion. And similarly avoiding unnecessary fights about colors and flags and things. To have a real conversation. I appreciate that input. But that's what I hope we can figure out, whether or not we vote on the flag issue today, is the intention of what that flag was put on there for. We should still have that and be mindful of it if we remove it. Like, what are we doing instead? His question of what have you done for me lately is fair and one to be mindful of. And I'll stop before I repeat myself or get mad.
Okay, I like that, Lee. So hang on one second. I like that, Lee. And so you're saying that the flag, if I heard you correctly, is neither here nor there. The intention towards inclusion and representing inclusion of communities is important. And acknowledging the higher mental health, substance abuse, suicide attempts and completions, that kind of stuff for this specific population. Am I hearing you correctly?
Yeah, and that if we keep that intention behind the putting it on there moving forward. So yeah, that's correct.
Good. And then just as a point of perspective, when we were doing the RAC card and we had sent it out for feedback, somebody said, hey, maybe we should put this on. And we said, hey, this is a good idea. So it wasn't belabored in the moment. It was suggested and we put it on. It wasn't a belabored discussion or thoughtful discussion on the last point.
Thank you, and don't be offended, but I'm gonna have to leave early,
Okay.
so I wanted to, but I have 3 points. One, I think going back to your point that it was talked about, everybody said there wasn't a belabored conversation, but it was talked about and it was agreed upon. And I think that's one of the things that bothered me, is that suddenly it changed after we had, as a group, agreed upon that. And 2, my understanding is the RAP card is for recruiting members of BHAB. Okay, and then BHAB is supposed to be supporting the county's mission of serving all individuals. And I want to concur with Lee's point of particularly some of our most marginalized in the world of behavioral health are queer community members. And so the idea, it doesn't necessarily even have to be a flag. The purpose of the welcoming or the pride flag is to show that all are welcome. And so if the flag doesn't feel good to people, we could do something that just says all are welcome. I mean, it's something that for everybody to know when they look at BHAB, because we need a more diverse group in here in a lot of different realms. And I hope that everybody is here to support anybody, no matter what their identities are in the world of behavioral mental health. And so if it doesn't have to be a flag, it could be something else that anybody who's thinking, oh, I want to be of service, I want to be a part of advising and behavioral health. I'm looking at this card and I see something that says I'm welcome no matter who the heck I am. I think that's what's really powerful.
Yeah, and I really like your point. And after the presentation from Ashton, hope I didn't call her Ashley. I didn't. Okay, but somebody kicked me when I do that, okay? Anybody kicked me, but not too hard. After her presentation, then I came up with some ideas, especially after Lee brought up his perspective and seconded kind of by your perspective too. So, okay, others?
Okay. Thanks everybody for sharing your perspective. I guess I come at it from like two different vantage points. One as a psychiatric nurse and my background and 10 years of working with, especially like a lot of transgender folks with really high rates of suicide and discrimination. And so as I've like studied how I can use my privilege as like a white woman and a cisgendered woman, I guess what I've come to understand is that the concept of allyship really is like standing with marginalized folks. And I thought that using the flag was one way to do that, was like a pretty tangible way to use my privilege. So I'm all for leaving it on the wrap card.
Okay.
You know, coming from law enforcement, you know, I know people lose their minds sometimes over what they think is the most important symbol that represents them. You know, and I'll just use the example of the blue line matter, you know, our blue line.
Yeah.
And so Deschutes County still has a blue line, right? And we've made a decision to keep that line on there. You can't tell the sheriff this, but I have no care whether the blue line, I was hoping they'd just take it off. Why? Because then it would never be an issue again that we have to deal with. Because actions serve more than the words or a symbol. Our actions do. And people will always criticize us. Even if our actions are great, people are not going to like police. Our real core message, though, is communication with the Board of we have a commissioner. Very few committees have a commissioner showing up their meeting and paying every day. I think we have to be welcoming, but you know, I just don't want to see our group lose our mind over a symbol or a flag. I did like what your presentation was. There's ways to do the win-win. And I think we should consider that. I've been here, about 4 years? So I wasn't here when that, we said we decided on, know who decided on.
Let me clarify that. What happened was there was some input between the subcommittee. There was input from the larger group to the subcommittee, which consisted of Christina, Roger, Dana, of course, was our magic worker, myself. Lorelai, were you there? So the feedback from the larger committee came saying, hey, let's put it, we discussed it and said, okay. It wasn't like we came back. And, this is really the first time the bylaws and the subcommittees, this is, I think, kind of the first time or a renewal of the kind of work that we've done here. So, we made missteps, okay? We learned, we moved forward. So it wasn't such that it became an agenda item. It was more like, oh, this sounds like a good idea. We want to be inclusive. So, but go ahead, continue, please.
No, and I just think at the end of the vote, we're going to vote. We're going to decide it today is what you said. Okay. Well, if we agree with that, hopefully we do. And I think at the end of the vote, we just accept it, and not lose our minds over it, right? And just move forward on it, whether you like it or not.
Yes.
So
that's the goal.
Could we just put, like what Cameron said, all are welcome? Could that be, whatever, we're adding some right choice voting here.
I do have suggested alternative wording when everybody's had a voice.
Okay, so that's all I'm saying. Something else.
Weighing in, I guess, I would worry that there would be other organizations that somebody would say, well, what about us? And I don't think that's where we want to spend our time. So I'll probably be leaning towards taking it off. But where we have all this dedicated space, I think we dedicate, a good portion of the card to talking about how all people are welcome, and we welcome these folks and these folks, and make it very clear that, we're open to everybody, and however that's worded. And then, I agree with Captain Schultz that my concern is if this is coming up now, there's going to be another one down the road and another one. It's like we had that conversation, we went through that exercise, and this paragraph, takes care of that issue. So that's.
We're going around. Yeah,
Well,
I
I
agree.
figure I want everybody at least say, I'm cool, I don't have a voice in this particular matter.
I'm with Julie on that. I think there's a way we can take the flag off and still have the same message, and then we match it with our actions to reach out.
Okay. Anybody else?
And this is maybe for further discussion too, of just, I think, big picture wise, what the pride flag represents. If you go to the stores and restaurants and you see that at people's homes, that it is specifically to, I think, the population of LGBT plus people because of how historically marginalized they've been in public spaces. And I think that maybe we're all kind of missing this, not all of us, but there's a different idea of what the flag means and what it represents of we are all welcome, or you are welcome here, and it's speaking specifically to that group. And I don't know if that's something that is causing us struggle with that, I guess, a little bit. And so maybe the idea of just either making it smaller and adding others, or just doing that language, all are welcome, right?
Anybody want to say anything that they haven't said?
I'll just say something that this happens a lot in other places. Where I go to church over here, about 6 years ago, we had a diversity celebration, and everybody that was from different countries, and they all had tables. So the sanctuary has been covered with all these flags, about 40 different flags for a few years of who the people in the congregation are. About 3 weeks ago, we went in and there's 180 flags because of this very same thing. We don't like the German flag or this flag, or so it becomes a distraction. And I guess that's the thing that's like the blue line, something to focus on, and it just becomes a distraction. I think you could do the same thing with spelling it out, writing the words, without the visual. That's my only comments.
Okay, so I'm gonna be a little. Well,
She's got my vote.
Oh, okay.
We're holding it in.
Your vote is what?
That I believe something welcoming should be on there.
Okay, so you're okay with flag going on as long as we get the message across?
Yes.
Okay.
So
So-
just something for welcome.
Okay, so I'm gonna do a little self-disclosure. It's a little vulnerable, but up until I met my husband 7 years ago, I was in the lesbian community exclusively. Came out as a person in their young 20s, back when wearing lipstick was really unpopular. So, and I did. So and now I'm an older person, and so I don't have a youth perspective. I still call women lesbians, and that's not very culturally correct. So what they are. So, so I just want to put that out from a little bit of my lived experience. But what I wanted to say about this group, and then I want to offer some wording, is Linda's right. Everybody has some really valuable, beautiful stuff. And I'm so glad, Dana, your foresight for having Ashley here provided me with the words. Why don't we just say that we're DEI, inclusive? That is not really go ahead. We can just put something like that. That is the county's mission, right?
Right.
It may not be in our bylaw commission, but as a committee or an advisory board to the county, it funnels up into their mission, which they have a paid staff to do now. So that might be one way. I don't know how to word it. I'm not the wordsmith here. But that might be a different way to approach the same thing, so.
I have an awful lot of ultra-conservative friends. I consider myself middle of the road. And I gotta tell you, it's really uncomfortable when somebody in the group talks about DEI or I have to go to DEI training. Some of these people are just livid, their teeth come out, and I think it's just so, the jargon that's out there, I'm not saying if I agree or disagree. I think there's some really healthy stuff that makes people feel better. And there's so many people living trauma-informed lives, I'm one of them. And, oh God, I've never been a coward in my life, and I don't think this is coming from cowardice, and I don't mean to preach. I believe those initials have become controversial and they're setting people apart. They're not meant to, but there's a backlash against that in the real conservative communities. And don't we also want conservative people to have mental health services? And I'm super concerned that we're jumping in the fray by using anything that's going to be associated with.
Do we have the same friends?
Huh?
Do we have the same friends? Are you a police officer?
Are there others?
I'm just joking.
Maybe they're not really friends.
You know what I mean, yeah, it's just.
I'm sorry.
No, that's good. We have some input here.
No, I agree with Linda. I mean, I am a huge DEI advocate. I'm gonna self-disclose that, but I also think we're in this age where certain terms and certain logos and certain phrases, certain flags just are, triggering political division, and that's the distraction that Captain Schultz was talking about. We don't need that. We don't want that. I think I can help draft some statements. It could be as simple as we welcome the participation of community members from all walks of lives, all political persuasions, all economic, whatever. I mean, I have to wordsmith a little bit, but put in it's the same thing as saying DEI. It's just, it's packaging it nicer and saying, look, if you're conservative, we welcome you. If you're an LGBTQ community member, bring it. We're here and we're an ally, but it's,
okay, so
I think a very simple statement that's maybe a one sentence elegantly written.
Without the acronym.
Without the acronym, without the flag, nothing that we can do it so that it avoids the controversy, but the statement is the same.
Okay, so I'm going to try and make a motion that here's what people are saying so we can vote on it with some follow-up action if we vote to take the flag off and replace it with something. So, and I may need help.
Yeah, good luck.
I would like to make a motion of removing the name the flag from the RAC card with substitute language to be developed by, I'm horrible, Melinda Thomas, and brought back to the board.
I'll second that motion.
All in favor, say. Hey, we did it.
Yay.
Okay, so now we have 10 minutes for subcommittees. But I just want to really say that this is a healthy functioning of a board, and that the process is so important. Thank you.
Thank you.
Thank you, Jessica. That was very courageous.
Oh, yeah, no worries. I'm used to it. Everybody else is shocked, not me.
Newbie, I promise.
Hey, so we have just 7 minutes here, so we'll keep this brief. We wanted to have some clarification and finalization around the subcommittees, and I'm just gonna list out what we had before, which is membership and onboarding. I have Cameron, Peter, Julie, and Melinda. As that core group, and do we
Yeah,
kind of know what that?
there was an email going around. I took my name off of that committee because there's so many strong people there. And then I added myself to the community outreach committee. So I'll be working with Lorelei, but she's gonna be leaving, so I'll take that committee on.
So you and Jill then?
Yeah.
Okay, perfect.
I don't know if this is the right time to ask because this is about clarifying who's on the membership, but we're gonna need like what the board application looks like and whether we can revise it because we're gonna have to start working on filling some spots here.
Yeah.
So
You can work with me on that, and then I can work with HR,
Okay.
should they need to be involved. I think we
We got
clarified.
some latitude that we've been looking for forever.
Yeah.
What?
We got some latitude that we've been, I think we're good to make some changes that are.
Yeah, so I.
For the board as well as the youth?
Yes.
Okay, awesome.
Yeah, I didn't even approach it just for the youth one. I was just like, this application didn't work for us. This is
Is
complicated.
that the one that we did for the youth?
I think we try it.
Yeah.
And all they can say is no, but we'll keep pushing.
Well, you and Linda know that it took like 6 months to get on the board. It's an easy decision.
As a person who's filled out a lot of county applications, it was easy for me, but as a person who would not have, it wouldn't have been.
Well, it's geared towards employment in
Yeah.
a public entity.
Oh, so, yeah, we can avoid the HR aspect of that, and then I can just relay, all the new information to the admin assistant for the board and commissioners. So you guys can kind of take that on and just loop me in once decisions are made.
I have an update on the community outreach. Lorelei and I met and we are going to table our presentation till next month. Just maybe retool the name and what our real direction and focus will be with that, and just kind of throw it out to the group and get some feedback, but maybe change it a little bit, but we can talk about that next month.
So you'd like to be on the agenda next month?
Sure.
Okay.
Thank you. Yeah.
And if we're doing a little update on these committees, I will just say we haven't had one application for the youth position. So.
What position?
Oh, the youth position, yeah. We had an inquiry about whether a couple of 30-year-old students could apply, and hopefully I spoke on behalf of the group appropriately, but I said, no, I don't think that qualifies, so.
We might be desperate enough for youth, younger, maybe not for this one, but
Yeah.
I would just like to
Used
see.
to me.
I would really like
Used
to,
to me at this point, 37.
I would like to really see an advocacy group subcommittee be developed. I mean, that's the one thing that has been really wanted from Patty, and we've got the Jackson piece, and a lot of questions came up. And I'd really like Melinda to head it with me on it, because she's a lawyer, and she really read that through, and she's got some great ideas. I'm throwing her under the bus, but that's what you get for not giving me wine that day, even though you offered.
My house.
Because you have the tools. And so I just want to put it out there for maybe the beginning of next year, because we will not be successful as a board to advocate with the knowledge we have and the structure we have. So that's, I want to put that out there.
Yeah, it is on the list of subcommittees that we mentioned. We probably don't have anybody on it yet. It's called Letters of Support / Advocacy. So I just put that you nominated her, and I'll let you guys talk about it.
Anybody want to second that nomination?
I didn't hear it.
You want to be nominated? Yeah.
Yeah, I'm fine. I guess I'm looking then at the membership committee and thinking that there's three members without you on it, and maybe other people could step forward and fill out,
Yeah.
round out.
Yeah, so let's talk about this, but she's a
Yeah,
a
I'm
lawyer,
happy
she's
to
strong
do it.
in that, she knows about it, she can pick things apart, I've seen her do it, and,
That's what my husband says.
Let's just make that a topic for next.
Yeah.
next.
Yeah, what does that look like?
Also, I want to ask about the board openings. I know you're going to talk about those, Roger, but you were going to call, there were 2 people whose terms were maybe going to be coming up, and you were going to see if they were.
Yeah, I'll do that. We still got 8 weeks or so. So I hadn't done that yet, and just figured out who is and who isn't. And just typical with, 15 board members and 3-year terms, it would be 5 vacancies.
Okay.
So just I'll check with the people that haven't voiced an opinion yet or desires, and then I'll.
Mine's coming to an end in December and I'm gonna step down. And I'm trying to find somebody else that from St. Charles to represent, so that'll be good.
Actually, you're here because you're Christine and not because you work for St. Charles.
This is true, this
We
is
don't,
true.
we don't have,
Lifetime membership?
we don't have corporate meetings.
Yeah.
So whoever they choose has to go through
That was
this.
really, that's right, yeah.
If they find somebody that really wants to be on the board.
Yes. Okay, so Roger, we are gonna meet in December?
I don't know.
Next one is November, so.
November.
Sorry, I'm jumping the gun. I just wanna know.
so typically we do not meet in December. So I think that we're gonna go with ritual and not meet in December.
Okay.
Yeah,
Is that?
less than a week before Christmas, so.
And then also, because Roger is retiring and I'm stepping down from co-chair, prayer and meditation, or however you make decisions in your life, we're gonna need them. So,
Five
prayer and
members to
meditation
fill.
doesn't work for you, go drink something.
Five board member spots to fill as starting January. Is that what I'm hearing?
There'll be 5 vacancies. Now, a couple of those people we haven't talked to